What?
Okay, this is our presentation on public health emergency planning by Addie, Lexi, Bryn, and me, Chloe. So our scenario is that a magnitude earthquake has struck in South Asia, flattening many villages and leaving hundreds of thousands homeless with limited building infrastructure. And government agencies have set up temporary housing and public health centers to treat those affected by the disaster. And due to the limited running water and unsanitary conditions and cramped conditions, cholera has spread. And several temples were destroyed during the disaster. So there's an additional sense of loss among the survivors.
All right, so for this section, we looked at nursing priorities. What would be our priorities as a nurse coming into this situation? And just to note that these are prioritized based on Maslow's hierarchy of needs. So first of all, shelter. That is one of the basic ones that we do need for survival. So this would be for anyone who hasn't been housed yet. And we would probably start with the more vulnerable populations. So the young, the old, the sick, the injured, and just coordinate with authorities to get them housing that they do need. Second, we would look at health. And so this would include the management of cholera through spread through water sanitization, personal hygiene education, promotion, and resource distribution, and also education on how cholera spreads, how it can be prevented, stuff like that. So more specifically addressing the health of the population, and just prevention and promotion, prevention of illness and promotion of health. And then lastly is spiritual and religious needs. This one is last because it is not necessary towards survival. It's kind of, it is on the hierarchy of Maslow's, but it's not quite as pertinent as shelter and health. So because the temples were destroyed, we would maybe want to create support groups or consult with the religious leaders and local authorities to erect temporary worship places, so that there could be that place to congregate for the community. Secondly, oh, what did I do? Sorry. Okay, secondly, for the communicable disease, this one is cholera. It is spread through the fecal oral route through food and water contamination. So it is very easily spreadable. So as a nurse, we would want to recognize the signs and symptoms of cholera and provide treatment for the people who have it. And then also again with that triage, so see who is worse, and who needs treatment first. There would be education needed again on food and water protocol preparation, and then sick protocol. So if you have a family member sick, what do you want to do? How do you prevent further spread? And then also collaboration with authorities to provide sanitary toileting areas that will just help in decreasing the spread and the contamination of water and food. So next, we're going to look at the epidemiological profile of the disease. So that is going to look at risk factors of the community, population, in relation to the specific disease, which is cholera. So as we said, it's spread through the fecal oral route, and it's currently considered an endemic in Asia. Because of this, it's highly communicable, both because it's already present there, and it is just the route through which it is spread is very like mass contamination. The community, they're living in close quarters. They have unsanitary and limited running water, and also temporary housing. So this is just a perfect place for the spread of all communicable diseases. There isn't, yeah, there's just lots of factors that are going into that. For the population, there's people of varying ages. They're also from rural villages, largely affected, leading to the lack of centralized care. So likely because they are rural previous to the earthquake, they likely didn't have as much healthcare previously. And so that can even complicate the care that we will be providing them now. As for the impact that all of this has on disease management, cholera is treated through IV and oral fluids and then also antibiotics, which can be very expensive, depending on where you are, how you're going to get to those people who are there, especially like the disaster or like land changes that have happened because of the earthquake. There is major need for education based on the population, disease prevalence, and hygiene practice. It also probably isn't, hygiene practice isn't probably the thing forefront in these people's minds, as they've just lost their entire livelihood, their houses, they've probably lost family. So that will be difficult to do because of the weight of all these other things that these people are dealing with. But it does need to happen. And it would be education on disease identification and then also on preventative measures.
All right, so next we have resources and agencies. I want to preface for local, it was a bit difficult to find local agencies just because the scenario does say like South Asia. So that could be many, many different areas, like that covers a lot. However, specifically the one that I found that, if a emergency were to happen in Bangkok, there is a agency called the Asian Disaster Preparedness Center. Pretty much they have the resources that you need to just to prevent any future disasters. So in this case, because hypothetically, if this were to happen in Bangkok, they would have those food, water resources, sanitary resources for the villagers. Next, on the national level, we have the Filipino-Japanese Emergency Response Association. This is located in the Philippines. This covers most of the country. However, I know that country is split into many islands, so it might be a little bit more difficult. However, they do have those resources. The next is the ADRRN, known as the Asian Disaster Resilience and Responders Network. Um, this could be, it's not really global. However, there are different posts in each country. So I guess on a national level, they have one in 21 different countries, very much similar to the association before. They're there for resources. They're responding to any emergencies that happen. Globally, we have the International Federation Red Cross and Red Crescent. This is the world's largest humanitarian network. Just as before, they are focused on preventative measures. They have what you need as far as medical. Just as Adia said before, these villagers probably don't have what it takes to uh, cover those medical needs. So this is a great resource to have. Next is the World Health Organization. I know we've covered it in past topics. However, they are focused on strengthening health emergency risk management systems. They're focused on limiting exposure before. So they like to do the preventative measures. And then they mobilize medical response teams. So they're focused on just getting everything ready. And finally, UNICEF, they are more focused on children, especially like with meals and like getting them water and all that. So although they may not be the first choice when it comes to disaster planning, they're great. If the villages do have a lot of children, they could come in and help with that. All right. And then next we have the ethical considerations. I thought it was great to bring in some of the ANA Code of Ethics just for even our country, if we were to go into South Asia and help. So first, the first provision that I thought was really great was provision one, which is just having compassion and respect. It's good to look at our own biases because in these countries, there are different faiths and religions. So it can be hard to care for somebody when they think something different. We might think of them as less or undeserving, but we need to understand that every life that we are caring for is in need of respect and dignity. The second one is the nurse's primary commitment. It is our patient, which goes hand in hand with one. We are dedicated to each patient, whoever we have. That could be the whole community or just a patient or their family. And this goes in all aspects, not just medical care, but even spiritual care. So if we can provide those resources for them, we have a duty to provide that. And then the fifth one, I also goes hand in hand, is the nurses owe the same duties as we would give to ourselves. It's almost like that golden rule, treat others how you would want to be treated. We're here to help others. And if we would think that someone would come help us, we have the duty to do the same. Um, that goes in with these faiths. I'm going to slide this to the right. So just some general considerations, just with any other religion, if this were to happen in our country or others. For females, it might be hard. They might not want a male doctor or nurse to care for them. So having both female and male nurses slash doctors would be great to have on hand. Having interpreters, not just family, is another great way to ensure that they are understanding the medical care that they need. Sometimes when you have family members, they might not understand the medical terminology that you're trying to explain. So that is why we would have those interpreters. Finally, explaining procedures to the client. This goes with the female provider slash nurse. If you have a female patient, and you're, or even male, if you're doing something invasive, you want to explain it before just to protect yourself and the patient from any harm and just to keep trust. Um, and going beyond that, there are other considerations. However, I felt that these were the most important. When going to spiritual and cultural considerations above, you can see that some common faiths I found were Buddhism, Hinduism, and the Muslim faith. So just making sure that we're respecting all of those faiths, no matter where we are in when we're giving care. Um, so some I found this to be very interesting, might want different therapies first. This goes with explaining the procedure to the client. They might not want you to give them something aggressive. Uh, so hypothetically, if they do have cholera or some other disease, we might see it as, oh, we need to give them an antibiotic. However, they might not want that aggressive treatment right away. So they like to do like yoga, certain remedies such as like oils or other natural remedies that might kill the bacteria first. They might want to try that. So as a nurse, we have to respect their decision on doing that. In some countries, or I guess in this instance, it's Southern Asia, they have jewelry to signify whether they're married or for other religious reasons. If we need to take that off, we need to explain to them why. And again, they have the autonomy to decline that. So we just need to do our best to explain why it's important that we are doing what we are doing. Finally, there are some spiritual books. I'm not going to try to say it, but as you can see, they are noted right there. Just like Addie had said, talking to spiritual leaders beforehand, making sure that there are resources for the patients. They might want to have prayer beads or those books, or even those spiritual leaders with them. We need to make sure that that's on hand to help them.
Okay, so next.
Oh, Bryn, you're on mute.
Can you hear that? Okay, so next we have the role of the nurse in disaster planning. Nurses, they're essential in disaster planning and relief efforts. Before a disaster, they help prepare by assessing risks, identifying vulnerable populations, and training both the healthcare teams and the communities on how to respond. After the disaster strikes, nurses are often the first responders. They provide triage and emergency care. They set up temporary health facilities, and they work to prevent the spread of the disease cholera. They also offer mental health support to help survivors cope with trauma. In the long term, the nurses assist with rehab. They teach the community about disease prevention and hygiene, and they provide ongoing care for vulnerable groups, including both the children and the elderly. Their quick response, infection control efforts, and holistic care make them very valuable in these disaster situations.
Okay, so following the nursing process, the first stage is assess. You first want to assess like all the infrastructure and earthquake damage and housing, which has been said that it was like greatly impacted. And then it's also really important to assess the disease process, which is in this case is cholera. You want to assess like which individuals have already been affected by cholera, how it's spreading, so like areas with higher rates. You want to find individuals who maybe are at greater risk, like children, individuals who are malnourished or like the elderly. And then because like clean water has a big plays a big role, you want to evaluate like the availability of clean water. You also want to assess like your overall population's access to healthcare, like if there's any hospitals around, hospital resources that could be used, the medical personnel, like that's at your exposure that could be used to help treat. And then, as mentioned, mental needs, because this is a really vulnerable situation, and as mentioned, many of them have already begun to like lose hope. So assessing their like psychological needs, like from the trauma and the grief and all the stress and anxiety, is really important, because that will play a role in like how they cope as a community. And then for diagnose, they are obviously at increased risk of cholera due to the contaminated water, lack of sanitation, and like bad, not clean water. They're also at risk for injuries and trauma from the complications from the earthquake, like crush injuries and all that kind of stuff. They are at risk for psychological impacts like mental disorders, like PTSD, depression, anxiety. And then additionally, they're at risk for like widespread impaired environmental social determinants of health, because they just lost their access to housing, clean water, healthcare, food security, things like that. And then for the next one, like plan, you should isolate and treat the cholera cases immediately through IV fluids, antibiotics, or rehydration. We want to improve their water and hygiene. We can create plans to manage injuries by setting up like specified areas for each health services and prioritizing patients based on acuity. We can also plan for counseling and providing mental services. And then intervention to carry out those plans. We would do, like I said, and we would set up mobile clinics to treat individuals. We would maybe try to distribute water purification tabs and set up hand washing areas. We'd want to help employ mental health counselors, as well as collaborating with all the agencies that Lexi had mentioned previously, locally and globally, like WHO and American Red Cross and all of that. And then a big thing for intervention would be to educate on like vaccines, proper nutrition, and the importance of good hygiene. And then to evaluate the outcomes, we would look at all the individuals' responses to like the injury treatment, the cholera treatment, and we would look at like the rates of new cases of cholera. We want to look at the recovery of all the individuals and assess that there wasn't any further complications. And then we would check the effectiveness of our mental health resources by evaluating the survivors' like stress levels and mental conditions. And then an important aspect to evaluation is also like evaluating the sustainability of the environmental plan, like long term, and how like the new like water sanitation, clean water and sanitation resources we put up, if they can be sustainable long term. And that's it.